Welcome, everybody. So to this week's Coffee and Talk, we have Marco Alfano, our Senior Research Fellow, talking about engaging senior citizens on digital technologies for integrated health and well-being. So, Marco, over to you.
Thanks, Paul. Yeah, I'm here in IVI. I'm a senior researcher, and I'm the lead of the digital health and well-being cluster. And I will be talking about these activities that we have been doing with senior citizens on the use of digital technologies for integrated health and well-being. And this comes from a problem that we see that the present digital health ecosystem is full of elements already in terms of people, in terms of applications, data, technology. But the person that wants to use this technology has to kind of sort out by himself or herself how to interact and who to interact with when to use this technology. So that is really can be overwhelming for the person. So the idea is to move for the present digital ecosystem that already contains all these elements, but just are scattered, and the person has to figure out how to interact with them in a more structured way, where the person, first of all, we consider the person as a whole person, so that not looking at the different health dimension, health and the well-being dimension of a person. So not only the physical, but also the mental, the social, emotional, and there are also other dimensions as well. So we need to understand an integrated health well-being model that kind of describes the person as a whole. And then we want to create an intelligent health assistant that is a kind of interface with the digital health environment. So on one hand, it empowers the person, helping him or her to understand, decide, and act about the health information that she gets. And on the other hand, is a kind of a single interface to this ecosystem, to this environment. You saw in the slide before, there were different elements just scattered. But through the intelligent health assistant, we can kind of order them in different layers, infrastructure, data, application services, stakeholders, and this intelligent health assistant can help to interact and communicate and cooperate with the right elements of the digital health environment. And so that we need to design the future digital health ecosystem, these three elements. And of course, the main element I'm looking at, but considering also the other two, is the intelligent health assistant. So I've been working on understanding how to develop this intelligent health assistant. I've already done some previous work, but this next phase, I really would like to understand what is needed and what is needed by people. So in order to do that, of course, I had this general idea, but I wanted to discuss and work with the people, with the user that they are going to use the application. So that what I started to do is what is called PPI, Public and Patient Involvement in Research. So it's a research that is done with the people, by the people, instead of just having a research that I think and then I evaluate. So that people is a two-way dialogue, and people are informing the research in all the elements of the cycle, or the research cycle. It's not just, so we are kind of used to evaluate our research at the end when we produce something, when we produce an artifact. But this is mainly when PPI instead is involving people since the beginning, since the idea, we discuss the idea with them, we develop, we evaluate, we communicate, we disseminate. So it's really working with people throughout the cycle, the life cycle of the research. And of course, PPI improves the quality of research and ensures that it's relevant to patients, families, to general public. So that is a really higher impact and less waste of research, because so we ensure that it's not something that maybe it will not be used. And it's becoming mandatory, by the way, with some funding bodies, some funding agencies like Health Research Board, but also other agencies. So we say that I find this very, very important, and I wanted to work with people. But at the same time, this is not easy. And I will just to tell you a little bit about how this worked in practice. So that we organize, and I was collaborated with a group of 4 people, and I will name them at the end, for very, very, very good people that helped me to prepare, to plan these activities. But just to arrive at the first focus group, you can see how many activities and how much time we spent. Tens of emails. This you can see we started planning in May, from June 23, just to advertise the first PPI focus group that was, let's say, tailored for older citizens, and because we want to really to involve them, because they really engage, they want to be active, and so we found that was the right target of people to involve in the research, and so that we started preparing, and we advertise in different venues, and we start also to prepare the first PPI focus group. So from May we ran the first PPI focus group in hybrid mode, but most of the people were present here exactly in this room in the end of September, and this took 10 meetings, again tens and tens of mails, a lot of different documents prepared. You can see there a presentation, so that because when you involve people, you really involve people that are not researchers. You really must be careful, so that must be evaluate everything with attention, and be careful to do the way that really they feel engaged. The focus group was a success. We send also a focus group feedback form to understand how they feel, how they felt during the focus group, and to get some feedback so that we could use. And for example, an interesting remark that we got, that an old gentleman was kind of some discomfort in using the all gender toilet that we have here outside. So for example, this kind of feedback, but this is important because people
Sto guardando le immagini.
Sorry, Piero, could you mute your phone, please?
So that and we spent other months to analyze the results of the first PPI focus group, and we got, these are just the results, are not so important. Today I wanted to talk to you about more the process than the results, but we got very interesting results about, for example, the relevant health and well-being dimension. Physical health is important, but also social, mental health, emotional health, health and well-being information, very heterogeneous: sleep, physical activity, social interaction, nutrition, stress. So you see how differentiated is the health information, health and well-being information that people want to deal with, and also the people and the elements of the healthcare system they want to interact. So GPs, nurses, in terms of people, but also specialists, community groups, institution, primary care, hospitals, application, symptom checker, electronic prescription, remote monitoring, patient portals, data about symptoms, vital signs, sleep. You see quite a lot of differentiated data and information that is very useful to characterize, because the objective of this focus group was to characterize the digital and well-being ecosystem, health and well-being ecosystem that I was showing in the initial slide. And one concept that came very interesting from the open discussion was to have a one-stop shop. So really I have one single interface to access all of this big amount of information, data, applications, people, institutions. So it's really, because there is a lot already there, but it's difficult for people really to figure out how to interact with them. So this is really came up from this focus group. And once we got to this information, we going to organize a second focus group to design the intelligent health assistant. Again, it took quite some time, a lot of meetings to organize it. In this case, was organized, it went online. Actually, we wanted to have it in presence, but because that day the weather was so bad, there was a storm coming out, we had kind of to change at the last minute to an online mode. But before, we already had the first focus group. People were already engaged, people already knew each other, and so it was easy to move online. So we had the focus group online, the second focus group online, very successful as well. We created an abstract for a conference, and it was accepted. So this is also very good result. We send again a second feedback form, and we are now starting we create a presentation for this conference, and we analyze the result of the second PPI focus group. And here again, just some results. I don't want you to bother with all the details, but it's a lot. Just this is some information about how to decide the intelligent health assistant. The interesting thing that we could classify the information that we got under the three empowerment steps: informing, understanding, deciding, and acting, and also connecting with the health, digital health and well-being environment. And the three main components that came out that people would like to see in the intelligent health assistant are to have symptoms, disease, and diagnosis. And this is good because it's related to the work that we already done with the CHAP application, but also to have an integrated health and well-being status. So really look at the health and well-being in a more integrated way. And this one-stop shop to the digital health and well-being environment. We are in the process, of course, of designing the agent. Again, maybe this will be the topic of another coffee and talk, but just to show you how much information that we got from people, and this is what people need. And interesting, just want to point out that what people, for example, in the acting and managing, people say that we want to be treated as a person, not as an illness. Being encouraged to be challenged to be the best version of oneself is a thought that when people becomes older, they just are creating problems. They are just they have to be treated as an illness. No, they are very energetic. They want to do a lot of things. They are very active. So that is really, this is why it's important to consider this integrated health and well-being. So not, of course, if you have a physical problem, you look after that, but there are also the other dimensions that must be considered as well. So the conclusions. So just some messages that we got from these activities. Again, I just wanted to show the process that the PPI that is really almost becoming mandatory for research on digital health and well-being. Again, for some funding bodies, but also others. Really is becoming more and more important, but not everybody understands what it is and also what it requires. And of course, it requires a great effort because we had just here some 20 meetings just from May up to now, 100 plus emails for 2 focus groups, but it's really fully rewarding. I have to thank the management team, Rebecca Clinton, who is the PPI officer, Ian Manouf, that we have, Daphne Garland, who is a well-being consultant, Stacey Grelis, who is a PPI advocate that really helped me a lot. Without really, I could not have done this without their help. And now we have a group of fully engaged people who follow us in all of the research. We will have a recording in the next week, and people want to collaborate, people want to move ahead, so that provided a great wealth of information based on their needs and experiences, and keep interacting, so that after the focus group, I still receive email from people who wanted to discuss, who wanted to be engaged, to keep engaging, wanted to be part of the research. What is important that they find the value in the research that you are presenting, because otherwise they will not participate. PPI also some PPI activities. If you have budget, you could pay not much, but something. We don't have a budget yet, but people, because of found research interested, they participated. They didn't care about having a token of appreciation or something like that. So What we are doing next, we have presented these PPI activities in this conference in Belfast in April. We will organize a third focus group to present some use cases, so to let them decide, okay, what we should really focus now, and to create a new project on digital technologies for integrated health and well-being. We are already doing something on that field, but of course, there is much more because the subject is very big. Thank you very much. And for information and collaboration, you can just write me if you would like to be involved in this project, in these activities. And also we have in the IVI website the digital health and well-being cluster, and you find there also all the information. And thank you very much, and open to question if we have any.
Thanks, Marco. So maybe we'll open it up to those online first of all for questions. Anybody online who's joining us have a question for us?
I think it's on mute.
Everybody's on mute, so if you have a question, please unmute yourself.
And Marco, I would just ask, sorry, here, just in terms of maintaining and retaining the people in the PPI, how did you find that? You know, did you have the same group that you started off with? Is there kind of anything to consider, you know, when you're forming your PPI groups?
Yeah, so sorry, you are asking for maintaining the relationship with the people, so that first of all you have to involve them, and so they must find interesting what you do. Then of course you keep them engaged, so that we were sending. So after the focus group, we were sending update. We send the result of the focus group. We invite them for a second focus group. We sent feedback. So the feedback form, we asked them to be involved. So is continuously involving them. Again, first of all, they need to find what your research interesting. Otherwise, they will not cooperate with you. But it's also keeping the engaging, so that I'm still working with people, and they write me, and I reply to them. So we have discussion outside the focus group, and they still provide feedback. So it's ongoing. So we are this presentation for this conference, and we want to create a video recording from some interviews, short interviews with them, to tell their experience, so they really feel that they are part of the process. Because the problem is that, and this is what is not clear, so PPI is becoming mandatory, but people think that it's kind of something you have to do. It's not really some added value. And of course it requires a lot of effort, but at the same time, as I said, is really highly rewarding, because people provide you with a lot of information, with a lot of support, and this is important. But you must be able just to give them also. So it's a really two-way. What I was saying is a two-way communication. So you communicate, you give something to them, is really both reciprocal for both parties. It's something useful for both parties.
Thank you.
Thanks, Gary. Thanks, Marco. Anybody else online have another question for Marco?
Paul, if I can jump in with a quick question, if you can hear me okay.
Yeah, now we can hear you, Martin. Go ahead. Thanks.
Marco, can you, at the very last slide, or second last slide, you talked about the next phase of the project. Can you talk a little bit about what you would like to achieve? Yeah, thank you. Where is it? Just scroll. I'm missing the last. There we go. Yeah, create the new project on digital technologies. Can you talk about what you would love to achieve and what your ambitions might be for that particular next phase?
Yeah. So we are looking at different aspects. So that, of course, the idea is to create a project that is embracing all the aspects. So this creating this new digital health well-being ecosystem that contains all these three components that I showed before. This integrated health and well-being model this intelligent health assistant, this digital health and well-being environment. But also what we saw is that we can create a kind of a very streamlined project to specific aspects. For example, one project is that I'm starting to look at is this one-stop shop, single interface to the digital health environment. And this also, so because again, this is kind of it's changing the whole digital health, the present digital health. Of course, it cannot be done in one step. This can be done step by step. So I already, as I said, I already have done work on the physical and empowerment on the physical health with the CHAP application. And you know, is already providing information, is already empowering. Of course, we can improve that. I'm started to work on this integrated health and well-being model, but of course it needs more. So that the project is a kind of connecting all these three elements, but also another possibility is focusing on something more specific, on, for example, for some specific condition or some specific need. So that I'm open both ways to both possibilities.
Yeah, thank you, Marco. Yeah, because I love that expression about the patient being at the center, and the whole world of healthcare is not about all the different hospitals and institutions. It's about a one-stop shop that integrates all that for the individual. I think it turns everything upside down, which is fantastic if we can pull it off.
Yes, also because patient at the center, and to me,
exactly
makes sense until makes partially sense because the patient is always at the center. The problem is that the point to me is what is the role of the patient? Is a passive role that is just receiving information, that is just receiving services. Of course, when you go to the doctor, you are at the center because the doctor is looking after you, or you go to the hospital, is looking after you. But what is your role? And this is why I've been working for many years now on patient or person empowerment, because a person who is empowered has the ability to better discuss, to better communicate. So it's not to get rid of the care system, but is to have a person or patient who better interact with the care system in a more empowered way, so that the result at the end, the decision can be the best decisions. Because I, as a patient, I know I'm the one the person who best knows is himself. And so I know myself. And the doctor, of course, is the medical expert. So if we combine these two expertise, we can get the best decisions.
So the patient is not passive. And
exactly.
Even in the GP, it's not about the problem that the patient has, it's about the patient overall.
No, it's always an active. It's always active. Is a patient who knows. The patient is not becoming a doctor, is not becoming a medical expert, but he gets that kind of enough information, and this technology can really help a lot in this case, can get that enough literacy and information and also motivation to make a fruitful discussion with the doctor. So it's not just told what to do. It's really deciding together what is best for him or her.
Excellent. Thank you.
Thanks.
Thanks for the question, Martin. Thanks, Marco. Anybody else have a quick question online before I turn it over to the room here? We have a few minutes left. Okay, anybody here in the room have a question they'd like to ask Marco? An observation?
Yeah, I have, and maybe I'm not understanding what you're trying to do. Is this a platform that you're trying to create, for the folks in terms of the one-stop shop that you're talking about, and where they will be able to access information, and where they will also be able to extract information from based on symptoms maybe that they have or something to that effect? Am I understanding this thing correctly, Mark?
Yes, it is. It is more because it's the ecosystem, so it's everything. So that I would just with one word just to simplify, but of course it's too simple. It is, of course, again, as I was showing here before, is first of all the model, because we have to look at the person as a whole, not with all the dimensions, all our dimensions. So not only physical, but also mental, emotional, social, spiritual, environmental, financial. There are many others. And then we create this. This is a system, a platform, an application, a platform, as you want to call, and is a kind of interface to the environment. The environment is the already existing application. So that in that case, a platform for what concerns the environment application. So you have everything. You have the infrastructure because you have the internet, you have the cloud, you have the wearables, but you have the applications, you have the data, you have the people. So all this that is already existing, and here in this case, you have to access by yourself, because you can have an online conversation, online, for example, consulting with a doctor. You can already do, but you must know the application, you must know the doctor. So if the agent can do for you, so you will then just need to know, interact with one single access point instead of having the teleconferencing application and to connect with the doctor, the booking application that allows you to booking an appointment, the application for interacting with your pharmacy, with your lab. So instead of having, you want to use the mindfulness application, you see just a few examples of different applications that are already there, but they are separate applications. I want to create a single integrated platform in this way. It's not that I create my application. Applications are there. So it's more kind of interaction, cooperation. This is why I'm talking interaction, communication, cooperation with this ecosystem world. That from my agent, I can, so this is an assistant, is your assistant. So instead of me interacting with all the application or the data directly, is the assistant that does for me.
Okay.
It's great.
Okay.
Thanks for the question, Leanne and Marco. So we're out of time now, folks. So yeah, we'll finish up. Marco, I think you have one more slide. Yeah. So just to join us for the next IVI Coffee and Talk, and we'll have Simon Hanratty talking about his project around burnout and in the workplace. And maybe technology's role in helping with that or the cause of it. But that should be a very interesting talk. So that's on Thursday, the 11th of April. Simon will be giving that. And please feel free to stay in touch with us via info@ivi.ie, by email, and also our social media, Twitter or X, LinkedIn, and our website there. So listen, thanks everybody for coming along today. Very interesting discussion. And we look forward to seeing you at the next one. Thanks very much.
Thank you. Thank you.
Thanks, guys.
Thanks.
Thank you, guys.
Thank you. Thank you. Bye-bye.
Bye.